A traumatic brain injury? Was your baby in a condition called fetal distress? Hello everyone, my name is Marcus Boston and I am a traumatic brain injury attorney helping families understand the cause of their baby's traumatic brain injury at birth. And namely for our purposes, that's going to be HIE, or hypoxic ischemic encephalopathy, which essentially is a reduction in blood and oxygen, which can lead a baby to suffer a brain injury. And when we are talking to families, a lot of times they have questions, specifically when there was no genetic abnormalities or there were no developmental issues. And then they want to know then, well, how did my baby suffer this traumatic brain injury if we don't have genetics and we don't have developmental problems that are associated with everything? And so what I would like to help you understand is that term fetal distress. And when I'm saying fetal distress, what I'm meaning is that your baby is no longer tolerating a vaginal delivery. Fetal distress can be problematic, especially if it's allowed to go on for a considerable amount of time and nothing is being done to rectify the fetal distress. When you were given birth during labor and delivery, and especially if you were at a hospital, you probably remember the doctors and the nurses hooking you up to certain types of machines. Namely, you may remember them putting something on your abdomen, a belt with the device on your abdomen. And what that is doing is it is hooking you up to the electronic fetal heart monitor. And this monitor is really important because what it can do is in real time, it can help the doctors and the nurses understand how well your baby is tolerating that vaginal delivery. And so where problems can arise is when the monitor is showing or displaying readings that should be concerning. And these concerning readings go on for a considerable amount of time and nothing is really being done to rectify these readings. That is when a baby can be in a problematic area. So that monitor can be looking at things like, for example, it may display late decelerations. It may display bradycardia. It may display tachycardia. It may show contraction problems or mom having too many contractions or tachycystole. There's a whole host of things, variability. There's a lot of things that monitor is looking at, and it's helping doctors and nurses get a feel as to how your baby is doing. And like I said, when doctors and nurses, when they miss the readings or they don't do enough to correct the problems, which could be leading your child to fetal distress, that is when you can have problems. Now, there can be a lot of things that can cause a baby to go into fetal distress. One of the common ones is when the umbilical cord becomes compressed. When you have compression of the umbilical cord, what that can do is that can cut off blood and oxygen to the baby. And of course, if that goes on for too long or it's not fixed, then you can understand that the baby can suffer a traumatic brain injury. And remember, earlier in this video, I said that HIE is a reduction in blood and oxygen, which can lead the baby to suffer a brain injury. When you have compression of the umbilical cord, what can that do? That can reduce or cut off your baby's blood and oxygen supply, which of course can lead to problems. So when I'm talking about this concept of a traumatic brain injury and whether fetal distress played a role, that is something that is important when we are investigating these cases, when we are looking to help families find answers as to the cause of the injury. Like what I said earlier, if you don't have any genetic issues that are present, if you don't have any developmental issues that are present, then there's a strong argument that's going to be made that something else was going on during labor and delivery. And one of these areas that we're looking at for investigation is, of course, that electronic fetal heart monitor, the readings on that monitor, and whether the baby was in a condition called fetal distress. If that distress goes on too long, if the conservative measures, moving mom, you may remember mom being moved, turned on your side, or given oxygen or a bolus, if these conservative measures, if they do not work, and the distress is still going on and it's for a considerable amount of time, then you can have that brain injury. That is why doctors and nurses have to be ready to move to an emergency C-section when warranted. Maybe you're watching this video today because your baby has suffered a traumatic brain injury like HIE and you have questions, you have concerns as to what caused it. Maybe there were no genetic issues for your baby, no developmental issues, and now you've got questions as to, was this birth trauma? Was this something that the doctors or the nurses or the hospital that they did which caused your baby to suffer a traumatic brain injury like HIE? If you have that going on, there is a telephone number on the screen. What I invite you to do is to go ahead and pick up the phone and call me. I speak with families like yours all the time about these types of issues. HIE, which is what we talked about today, cerebral palsy or subsequent cerebral palsy. Sometimes babies who have an HIE diagnosis, some of them, not all, some of them can go on to have a subsequent CP diagnosis. That's also another issue. Maybe you have meconium aspiration syndrome or shoulder dystocia. All of these types of things, this is what we do. If you have those questions, I invite you to pick up the phone and call me on the number that is on the screen. When you call my office, make sure you let my secretary, let them know that you would like to get on my calendar or on our calendar, pick a date and a time. That's important. Make sure you pick a date and a time so I can know, or so we can know how to get back in touch with you, the day and time to get back in touch with you. One more thing before I get out of here. I practice law here in the state of Maryland, and this video is on social media, it's on our website, it's on the internet. I cannot control who's going to watch this video or who is going to reach out to me. If you reach out to me and you are not in the state of Maryland, please understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can help work with you on. But I just want to make sure that you understand that co-counsel or that local counsel aspect of things if you are not in Maryland and you reach out to me. That's going to be it for today's quick educational video. Again, I am Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care. Enjoy the rest of your day.